Welcome to the Health Rising podcast, where we empower you along your health journey. I'm your host, Dr. Jordan Salmon, and together we'll explore the steps to greater health, hope, and happiness. Let's rise together. Hi there. Welcome to the Health Rising podcast. I'm Dr. Salmon. I thought I would first just introduce myself, tell you who I am, why you might want to listen to this podcast, and what I hope to uh, talk about in these episodes. So, I'm Dr. Jordan Salmon. I'm a practicing family physician in the Houston, Texas area. I practice as a direct primary care physician, which I can talk more about in future episodes, and why I chose to practice as a direct primary care physician. But in this episode, I really wanted to talk about kind of my experience as a health seeker, so a patient. This was dating back, for years. I struggled with my weight, with my health, I would say. I've been overweight for most of my life, and struggled as well with some of my mental health, which I can get into kind of more in depth in future episodes as well. But I was practicing as a physician in an emergency room, and this was during the pandemic. So the pandemic hit, and my hours were cut because there were not as many people coming to our emergency room at that time. And so I had more time on my hands than I knew what to do with. And so I did what is a common thing that maybe many of you did, is I started watching more shows. There's plenty to watch these days. And so I started enjoying a lot of, getting into new shows, watching TV, kind of lazing about, eating a lot more food. And before I knew it, I was obese, and I was pretty depressed, and I was not doing so well with my health. And I was a physician, which is a little embarrassing, I will say. But I thought to myself, okay, I'm obese, but I'm a doctor. So what would I tell myself if I came in to visit with myself? And the answer was lose weight. And I realized I didn't know how to do that. I mean, yeah, we talk about how you lose weight, you got to eat less, eat healthier, all these things. But yet I was still obese. And I think that that is something that I've come to realize, that none of my patients who are obese, who are struggling with their mental health, who are dealing with any number of these health challenges that we commonly deal with, nobody wants to be obese or to struggle with their mental health or to have any of these health ailments that we all um, deal with. And yet we do. And in this podcast, I really hope to delve in a little bit to what is health and help you to understand how to improve your health and what that would look like, and what are those steps that you actually do that. So going back to myself and my story, right? So I was obese. I was not doing so well health, from a health perspective. And so I started a health journey, is kind of how I talk about it. And I began to learn and grow and discover some very important things that led to what I consider to be a health transformation. I started waking up early, reading my scriptures, and exercising. And that was kind of the start, right? It was small. And that's an important thing that I'll talk about in future episodes, right? is that these changes that we make when we're trying to improve our health or make changes, trying to do too much at once can be overwhelming and often leads to a lack of a significant response. And so, as I began to make small changes and kind of gain control over that little change, and then I would add another thing and another thing, and I would make another little change and another little change. And this snowballed and grew until I ended up um, getting to a place where I was much better with my mental health. And I had lost 65 pounds, which I have maintained a healthy weight today. And I learned a lot about eating, about emotional health, about mental health. I studied a lot about cognitive behavioral therapy, which I think is extremely powerful to help anyone to improve their mental health and to discover important truths about themselves and about the world in order to be healthier, so to speak. Well, what I really wish to talk about in these episodes and on this podcast is what I have learned from my experience, this kind of combined experience as a practicing physician and as a health seeker who has struggled with many of the things that my patients struggle with. And how do we get out of that? How do we improve our health and get to a better place where we are happier and where we are healthier? And that is what I really want to address. Essentially, it's what I don't get paid to do as a doctor, which I'll talk for just a minute about. In our current insurance based fee for service healthcare system, I get paid as a doctor to see patients and to prescribe them things or do procedures to them. And that, I think, is one of the fundamental flaws with our current healthcare system. Because what I discovered in my own health transformation journey is that you are the answer to improved health. That power to improve your health is within you. And learning how to tap into that power and how to make those changes is what will lead to your health transformation. And I strongly believe that. I think that that's a really fundamental component of improving health. And with our current insurance based healthcare system, essentially we tell people we have the answers. We are the way to health. And I don't think that that goes over very well. And I think that that actually leads to a lot of um, inactivity, passivity, and ultimately contributes to a lot of our obesity and our poor eating habits and all of the a lot of the struggles that we deal with because we think, well, the answer is in the healthcare system, right? And I can't do anything about it. So I've just got to go see my doctor. And recognizing how much you can control and how much that you can do to improve your health is critical to starting that process, right? And there's a lot of things that I hope to kind of go over and review and things that I love to teach my patients and help them to understand that I think are really transformational concepts that can lead to a much better health and can really help people in ways that I think are important. So that's kind of where I'm coming from. I'll talk about kind of my views on health and what I've learned through this process and this growth journey. And I really hope that you can gain something from it, that you can feel like listening to these podcasts helps you to take control of your health and recognize that you really are the most important key to improving your health. And when you realize that and you recognize that and you take accountability and ownership for that, it leads to a transformation. And a lot of times I think we think that as I think about my, if I take accountability for my health, then that means that I get overwhelmed because I'm obese and because I'm not where I want to be. But really, when you start to gain that accountability and you recognize that I am responsible for my obesity or my health, some of these health challenges that we deal with, then you can begin to recognize that you also can be the key to getting out of them. And discovering that and how to make that happen is really the process that I want to talk about. I love, addressing these things, and that's where I hope to go with this. I hope that you'll find it useful, and that's all I have. So, thanks for joining me. Thank you for joining me for this episode of the Health Rising podcast. I practice as a direct primary care physician in the Houston, Texas area. You can read about my blog and learn more about direct primary care at healthrisingdpc.com. If you have any questions or thoughts you'd like to share, feel free to message me on X or on Instagram at healthrisingdpc. Until next time, remember to choose health and be kind to yourself.